on Tuesday, Baystate Medical Center is hosting a forum on first response for veterans and crisis. The course is designed for EMS, first responders, and emergency departments, among others. Carolee McGrath sat down with David Sutton from the One Call Away Foundation and Ida Konderwicz, a registered nurse and injury prevention coordinator at Baystate Medical Center, to find out more.
I was approached by Cindy Foster, who's a paramedic for AMR Ambulance, and she had some concerns that she was seeing an uptick on veterans in crisis. And what she wanted me to help her with is put together a program so that the first responders can become educated on how to handle veterans in crisis.
Okay, and now you are also a nurse, and you worked in the ER for many years, and obviously you've cared for veterans when they've come in for different reasons.
Yes, I cared for veterans in crisis in the emergency room for many years, and our main theme there is to keep them safe and to keep ourselves safe.
What are some of the topics that are going to be covered tomorrow to help first responders or help ER doctors, be better informed?
We brought folks together, and they decided that we needed to have folks that were first responders speak about that were veterans and how they approach a veteran in crisis. We have psychologists that are going to be speaking about how to approach a veteran in crisis. We have someone coming to talk about the battle mind and how their mind was and when they were in service and now when they're home, how to reintegrate them into our normal world. And we also have Just Ask campaign and a few other speakers that we've had. So it's going to be providing education to our first responders. We have police officers that are attending, some firefighters that are attending. We have social workers and psychologists and emergency room personnel that are going to be attending our conference.
Okay, so David, One Call Away is one of the partners that brought this together. Tell me a little bit, first of all, about your organization and what you do.
Well, One Call Away is PTSD support, and we have a PTSD support network. And we also are to aid in the prevention of suicide. Well, one of the things that we do, we have all kinds of organizations that we work with, recommend, and train with. And so when we run into a veteran who's looking for a high level of care, that there are places that they can get into to get it. And if somebody's having an issue, we'll be called in as a peer support, help them get through tight situation, somebody to talk to, if they want to just get things off their chest.
And so that's what your organization does.
Yep.
When you're helping people understand how the best way to approach and perhaps even the best language and body language to use with a veteran who might be in crisis, how do you explain that to, maybe to the layperson who's not familiar with what they've seen? I mean, we can't even imagine.
I can give you a circumstance that happened that really gives you an understanding. A while back, a family member asked me to go be with their son. Okay, and he was in the emergency room. So I was there, and when I first got there, he was in the room, and he was backed into a corner. I could tell by the look on his face. The nurse that was there and one of the orderlies were there, and the closer they got to him, the further he backed up. And finally, he got to the deepest corner, and that right there, I said, "Excuse me." When I walked in the door, I said, "Stop." I said, "You guys need to leave." I said, "Just step out of the room for a little bit. Let me have a chat with him, okay?" Because they were putting him on defense, and he was going into fight or flight. And he just needed somebody to let him know that he was okay right there and then. I walked in the room, I basically just asked him to stand down.
And that was a quick de-escalation technique
Yep.
that you would know how to use, but perhaps somebody else who's pulling somebody over, maybe a traffic violation, didn't put a blinker on, would not know that.
They wouldn't know that. I didn't even know that this One Call Away existed before I started, so I've gotten myself quite an education in this field of veterans in crisis. And I'm so glad that they're there, and we want to spread the word to all of our emergency rooms, because Baystate Health is across Western Mass, and to our first responders that there is someone that you can call to help you figure it out.
And also, David, your son served 2 tours in Iraq.
Yes, my oldest son did 2 tours in Iraq, and he was shot twice, and that led to a lot of situations with him. One of the things was drug addiction. He got addicted to the painkillers and stuff that he was on. He had violent outbursts and anger issues, and him and I had a lot of times talking. He was one of the reasons that I started One Call Away. He was suicidal. and he was hurting, and he just needed somebody to talk with. I did too many veteran suicide funerals, and I thought about my son. I thought about my life, where I was at a certain time, and said, there's got to be something we can do. And now that we've been around for 3 years, I've had circumstances and events that brought me together with individuals where I was able to use some of my past experiences just from the things that I've been through.
And I think when you look at the number of people that you have coming tomorrow and the different groups, you know, from first responders to medical professionals, psychologists, obviously one call away in other organizations, you're really bringing so many different people to the table to address the fact that you have men and women who have been in combat, who have seen things that we couldn't even imagine, who are now just supposed to be like everything's normal. Just coming home.
But you know, it's not just combat, because you have combat roles, infantry and other things along those lines. But you have a lot of support structure in the military that were put in harm's way and have dealt with things that they really weren't even trained to handle. You got folks that work in logistical movements of materials and goods and stuff that has to get to the front line, you know, dealing with IEDs, dealing with friends that were killed, dealing with being away from home. You know, all these things all come into play. There's a lot more to it than just a combat situation, even though that's the biggie. But also there's a lot of things that they bring back with them. You know, they bring back a guilt with them that can never be taken away.